The U.S. government has spent more than $25 billion on Pfizer and Moderna COVID-19 vaccines. According to a new analysis by Kaiser Health News, the federal government has so far purchased over 1.2 billion doses. That's an average price of nearly $21 per dose. These vaccines have been provided free of charge to people across the nation, but that could soon change. That's because the Biden administration could stop paying for COVID-19 treatments. That includes Paxlovid, a drug that has proved effective at keeping patients out of the hospital. Joining us now is Dr. Céline Gounder. She is an editor-at-large for public health at Kaiser Health News. She is also an infectious disease specialist and epidemiologist and a CBS News medical contributor. So, Dr. Gounder, how much are we talking about if in cost if these are no longer, both the vaccines and Paxlovid, if they're no longer free to people?
Paxlovid was purchased by the federal government for over $500 a course. Those numbers will certainly multiply by several fold for the average person who's having to pay out of pocket. We know that insurance companies will cover at least some of the cost of this for some people, but people who do not have insurance could be facing not only the cost of Paxlovid, but then the cost of the doctor's appointment to even get the prescription.
Right. And so if we're most worried about older Americans, what would the relationship between Paxlovid and Medicare be? Would that be covered?
Well, this is a real issue of timing. So right now, as long as the public health emergency remains in place, Medicare would cover Paxlovid once it became something that would be not provided for free by the federal government. But once that public health emergency comes to an end, if Paxlovid is still not fully approved by the FDA, if it's still under this emergency use authorization, then Medicare won't cover it. And so we could find ourselves in this window where Medicare does not cover Paxlovid. The people who most need it, the elderly, could find themselves not able to afford it.
And also there's a CDC study that said Black and Hispanic patients with COVID were much less likely to get Paxlovid than white patients. So presumably, if this commercialization of the drug would hit those communities even harder.
Be even harder because already they're having difficulty accessing because you need a prescription. So you have access to care issues. And then on top of that, now you have to actually pay for the drug potentially. And we know that there are higher rates of uninsurance, not having insurance among Black and Hispanic communities. So we will see widening disparities in access to Paxlovid.
So we've been talking now about the treatment once you get it. Let's talk about the vaccine. So hopefully you don't get it at all. First of all, on the cost question, if the administration if you're no longer getting them for free, what would a jab cost you?
Right now, they cost about $20 a dose to the administration. We're looking at seeing that cost go up 3 to 4 times, so maybe $100 a dose for the vaccine. And again, on top of that, you have things like the doctor's appointment fee, a vaccine administration fee. So it's quite a lot more than what people are looking at now, which is free.
Right. So then the public health question. Let's imagine there's a new variant, as there undoubtedly will be, right? And the mRNA vaccines are tweaked to fix that new variant. Okay, everybody's got to go get a new booster. If they cost, how problematic will that be in terms of trying to get enough people covered so that we don't have a bunch of people walking around with COVID?
Well, even right now, only about a third of seniors, and that's the group that is highest risk for complications at this stage in the pandemic, only a third have gotten the updated bivalent booster. And so if you're adding on top of that additional out-of-pocket costs, even if somebody has insurance that covers some of this, you're still going to probably face some out-of-pocket costs. And so we will see fewer people accessing vaccines as well as treatment.
And so for the vulnerable communities, that means they won't be protected. But then also, is there a challenge or a problem if you just have a lot of COVID in the community that has its own problems and challenges in terms of mutations and that kind of thing, right?
Right, because you're going to see with less vaccination, you will see more transmission. The vaccines are not perfect in preventing transmission, but they do take a big dent out of that. And then on top of that, if you have people who are getting infected who can't access treatment, more of them will end up in the hospital. More crowded hospitals means not just, trouble for COVID patients, but really for everybody who's in the hospital.
Right, that familiar cycle. All right, doctor, thank you so much for being with us, as always.